Okay, this video is iron overload and the effect of excess iron on the heart. This is part 6 of the iron overload lectures. Okay, so why do premenopausal women have fewer heart attacks? We talked about this before, but for multiple reasons compared to men of the same age. It's not the cholesterol. They have very similar cholesterols, but the men have far more problems with atherosclerotic disease like heart attack and impotence, of course. It's not the estrogen, because estrogen actually is a little bit prothrombotic, and it's also obesogenic. It's a fat storage hormone, makes a woman gain weight. Menstruation is the correct answer, because when they menstruate, they lower the hematocrit, the number of red blood cells percentage-wise in their blood. So their blood is less thick, lower viscosity. A less thick fluid is easier for the heart to pump, so that lowers blood pressure. Lower blood pressure means less atherosclerosis. The red blood cells, more of them are immature, coming out of the bone marrow to replace the menstruated cells. They therefore are more flexible. Young red blood cells are more deformable. They can bend easier as they pass through the capillary. A red blood cell has to bend when it passes through a capillary because it's about 7 microns in diameter. Capillary is about 5 microns in diameter. There's less glycation with the younger red blood cells. There's less of the phospholipid, phosphatidylserine, abbreviated PS here, externalized, meaning more of it's in the internal leaflet of the plasma membrane of the red blood cell. As the red blood cell gets older, it moves to the outer leaflet, and that also contributes to stiffening of the red blood cell. They also have lower total body iron storage, so that becomes more of a factor as it accumulates more in men, of course, after the age of 20. In the United States in 1986, the difference in age between men and women at the time, average time of death, was 7 years. Women dying at an average of 78 years of age, men at 71 years of age. Those numbers are going down. People are dying sooner. People are becoming less healthy. That's why you have to ask yourself, how good is conventional medicine if the people are sicker? And how good is the so-called recommendation of the Mediterranean diet if the people aren't getting better? And of course, the standard American diet is, we know all about the problems with that. Okay, so why is meat so bad for heart disease? Of course, it's high in saturated fat, rouleau formation, blood sludge, hypertension, insulin resistance. Okay, disaster. High animal protein in and of itself, even if you had something like skim milk, will still cause elevation in cholesterol. I think it induces an anabolic phase in the human body because it activates mTOR, okay, even without the fat. Even the fat makes it activate mTOR even more. High TMAO, trimethylamine oxide, that's unique to meat-based diets. Okay, high heme iron. You're going to be absorbing more heme iron. You're going to be more prone to oxidative stress and to becoming iron overloaded. Okay, and that can cause problems with other parts of the body. Let's see. When you add, another thing about predicting the risk of heart disease, you can predict the risk of heart disease by total cholesterol level, but it's even more accurate if you simultaneously correlate that with total body iron, like storage iron. You can use the serum ferritin as the easiest thing to use. Here's just a couple articles related to increased body storage of iron being associated with increased cardiovascular risk. I can tell you some of the most famous atherosclerosis researchers in the world. For example, Gregory Sloop, MD, is the guy who wrote the book on the contribution of increased blood viscosity to atherosclerosis. He donates blood a couple times a year to get down his hematocrit, to lower his blood pressure, and to protect him from atherosclerotic disease. I mean, the diet is by far the best thing you can do, but there's some people who will do this blood donation, and it can supplement it, I think, in the early phase especially, but in the long run, the diet's by far the most important thing to do. And then there's lots of papers showing, the people with lower serum ferritins have lower cardiovascular risk. Okay, and we talked about the reasons for that, the lower ferritin. So you'll find paper after paper. Ferritin less than 200. Person with ferritins over 200 have 2 times increased risk of myocardial infarction. So anyways, that was just a quick lecture on elevated iron levels. Elevated serum ferritin levels are associated with increased risk of heart attack, coronary artery disease.